and welcome back to the Ask Dr. Renee show here on BlackDoctor. And so first we have to do some housekeeping. I know that you know somebody that has diabetes or is pre-diabetic, whether it's type 1 diabetes or type 2. Please share this broadcast right now. I don't care where you're watching. Just share it. Send it in a text message. Send it via Facebook, Instagram, whatever it is. Just send it, please, because this information is coming from an expert. And I know she's going to give you information that can help you because she's helped a lot of people already. Okay. So that's first things first. So make sure that you have subscribed to our channels. My channel, of course, is Ask Dr. Renee. And then, of course, BlackDoctor.org. And I'm sure you've already liked our page, BlackDoctor.org. Excuse me. Sorry. But I'm going to give you, I'm going to introduce you to my friend and then make sure that you follow all of her stuff too. Because like I said, amazing information from an expert. Okay. So let's get started. Good evening, Dr. Kelly.
Hi, Dr. Renee. Thank you for having me on.
Oh, no, thank you. So you guys, first, I have to start off with an oldie but goodie. The very first time Dr. Kelly ever appeared here on BlackDoctor, I'm going to show you guys. We both have had a huge transformation, and maybe we'll talk about that on another show. Hi, good afternoon. It's still morning here in Chicago. This is Dr. Renee, and I am here doing Facebook Live with BlackDoctor.org as usual. And today is, November is Diabetes Awareness Month. So I thought, who better to speak about it than, of course, Dr. Kelly Wood, who is an endocrinologist, and we'll talk about that in a minute too. But Diabetes Awareness Month and Thanksgiving being next week, and I want to make sure that all of my diabetic friends can eat but not get sick, because we don't want you in the hospital during the holidays when your family is around and when you should be shopping. So, Dr. Kelly, welcome.
Thank you. Thank you for having me.
Oh, thank you for coming. So, you guys, what I have to say, few things never change. The same earrings are in my ears and white nail polish. I got white nail polish the first time me and Dr. Kelly went and got our nails done, May of 2019.
Oh, wow.
I have been wearing white nail polish ever since. I have not switched. Isn't that funny?
Yes, it is.
My nails that day, though, were still stubs, and now they've grown. But yeah, so Dr. Kelly and I both have lost a lot of lbs because I'm sure I do know. So we both have diabetes in our families, and so we eliminated our risks by making sure that we lowered our weights. So let us get into it. Dr. Kelly, first of all, just like we started that one, because there's some new people here, what is an endocrinologist?
So endocrinologist is a doctor who specializes in hormones. So the reason why diabetes falls under my specialty is because of the hormone insulin. Other diseases that I would treat would be like thyroid disease. I do some vitamin D and some osteoporosis, but the majority of my practice would be diabetes type 2 and type 1, as well as thyroid dysfunction.
Perfect. So let's also break down the difference between type 1 and type 2. So let's start with type 1 diabetes.
So the first thing, let's start with diabetes. Like, what is diabetes? Yes. Well, we like to call it a little bit of sugar, right?
Look, just like you can't be a little bit pregnant, you don't have a little bit of sugar.
A little bit of sugar. So basically, glucose is the main energy source that our body uses. And insulin is the hormone that takes glucose from the bloodstream into the cells where it's used for energy. In patients who have type 2 diabetes, their pancreas makes a lot of insulin, but the insulin does not work. You can think of it as insulin is the key, and the key for some reason not fitting the lock. So glucose can't enter into the cells. With type 2 diabetes, lots of insulin is around, but it's not working. We call that insulin resistance. In type 1 diabetes, however, it's an autoimmune issue where your immune system makes antibodies that attack your pancreas and causes your pancreas not to work. Patients with type 1 diabetes usually develop this as children, as teenagers, and sometimes even as young adults. Type 2 diabetes is more of a lifestyle disease. You have a genetic predisposition, but then you also have environmental factors like lack of exercise, not having a healthy diet. That kind of comes together to form type 2 diabetes. Type 1 diabetes, there's currently no cure for type 1. and it can't be reversed.
So, and I know that there's many studies going, and hopefully they will get that fixed soon. Um, Somebody already typed in, said they have type 2 diabetes. But I think that one, when I was growing up, we always called type 1 diabetes um, child's, like children's diabetes. And then we called type 2 adult onset diabetes. But as many of us know, especially here in the US, the obesity rates in kids has gone through the roof. So yes, adults are also, have high obesity rates, but the children's obesity rates have gone so high that now children are being diagnosed with type 2 diabetes. And I know you don't treat children, but a lot of pediatricians are now having to send kids to pediatric endocrinologists because they have type 2 diabetes. And I'm talking like elementary school. So it's really, really a problem. I actually just heard about a child who's in elementary school that's pre-diabetic.
Most definitely.
So what'd you say?
I get to see, so when these kids become like 21, 24, they get transferred over to me. So I have quite a few patients actually who were diagnosed with diabetes as a teenager, as 12-year-old preteen. So I get to see those patients eventually as well.
Yeah. So it's awful, but and it's crazy that it has changed that way. Then also on the other hand, type 1, I actually know a couple adults, and I'm talking people that are past 40 that were just recently diagnosed with type 1 diabetes.
So there's a subtype of diabetes that we can call type 1.5. The actual term is LADA, LADA, and it stands for latent autoimmune diabetes in adults. These patients have the same antibodies to the pancreas that a type 1 patient might have, but they have them in much lower amounts and might not have as many types of antibodies. So they develop type 1 diabetes later in life. A lot of these patients are initially diagnosed as type 2 diabetes before someone checks the antibodies and find out that they're present. Some of these patients initially don't need insulin, but a lot of them eventually need insulin like a type 1 patient does.
Gotcha. And then, of course, now, I mean, anybody who watches TV, there's so many commercials that talk about diabetes. Can you tell us some of the things that we're watching? Like, first of all, I know that Freestyle Libre does amazing commercials, and actually one of my friends does ads for them for Instagram. But tell us about these products.
Yeah, the field of diabetes is really exciting. There's always some new gadget out there, lots of new medications. I would say maybe over the past like 7 to 8 years, there have been lots of new medicines. So what you're talking about is a continuous glucose monitor. These are some little devices that you insert into the interstitial compartment, and that's the compartment right under the skin. And they check your blood sugars every couple of minutes, like every 5 minutes or so, it checks your blood sugars. The two available ones that I use are Freestyle Libre, and it's also, you might have seen Dexcom commercial and television as well.
So Dexcom, is endorsed by the lovely Dame Dash. If anyone is a connoisseur of rap as myself and knows Dame Dash from Rockefeller Records, he uses Dexcom because he is a type 1 diabetic.
A lot of these sensors, you can actually use your smartphone to scan. For the Libre and for the Dexcom, it can send the information directly to your smartphone. So it's really convenient for the patients because they don't have to stick their fingers as much. And for us clinicians, it can give us a better idea of what's happening with our patients' blood sugars, even when they're not checking. Like, for example, when they're sleeping, you can see low blood sugars that happen during the night that a patient might not know if they're just going off finger sticks. A lot of these sensors also have alerts so that if your blood sugar is dropping or on its way down, it can alert you so that you can go and maybe have something to eat or have some glucose tablets. It also alerts you when your blood sugars are going really high. And what I've found is that it can actually change behavior, because if you have diabetes and you eat, I don't know, a bowl of, give me something, bowl of like some kind of cereal that you're not supposed to eat in the morning, like Frosted Flakes, right?
Yeah.
And you eat that every day, and then you start wearing the sensor and you see your blood sugar going up to 350 in real time. That might make you stop and think the next time, maybe I shouldn't have these Frosted Flakes. So I've had patients who just by putting them on a sensor have been able to bring their blood sugars down. So if you have diabetes, ask your endocrinologist or even your primary care doctor if you could benefit from a sensor. I know for a lot of our Medicare, a lot of our older patients on Medicare, Medicare does cover it for free if you are on more than 3 shots of insulin per day, 3 or more shots of insulin per day. For the commercial insurances, some of them do cover the sensors.
That is important. So I really want to stress right now that you need to understand that, can you imagine that you don't have to stick your fingers? And I think the other reason why the doctors like it is because, God bless them, but just like any other thing that you have to take or do, you're not going to necessarily remember to do it all the time. And so that's why this would be great for the doctor, because as you said, it's all recorded into the phone. So therefore, when they show up for their doctor's appointment, you can just look at the information. It's all there recorded on the phone. You don't have to rely on the patient writing it down somewhere or anything like that. So and then of course, as Jay-Z says, numbers never lie. So numbers don't lie. And so that's why people probably are more compliant, is because they actually see the numbers. You can tell them a lot of things and they won't believe you. But when they actually see the numbers for themselves pop up on their phone after they eat whatever, and they're like, oh, maybe I shouldn't eat that. So it's really important. Accountability is really great. And so, yeah, I think that that is just a huge leap into diabetes. That is a huge, huge, huge benefit, because I've heard even the equipment for the finger sticks is not cheap, and all these things that insurance sometimes pay for and sometimes doesn't. And
yeah, unfortunately, a lot of diabetes medications are really expensive, and it's kind of sad because 32 million or 34 million Americans have diabetes. And a lot of them, especially for type 1, depend on insulin, and insulin is just super expensive. But I know that a bill was passed to lower the price of insulin coming in 2023. So I'm looking forward to that, because a lot of my patients have had to ration insulin because they can't afford it.
That's awful.
I've had to switch to older, cheaper insulins because the ones that I want to put my patients on, they sometimes start on it, then the insurance changes in the new year. They have to go to something else, and it's a lot of work, a lot of work.
Please, I do see one question and we'll get that answered. But please, if you have questions, please type them in the chat. I will see them. And LinkedIn might be the only one that I don't see your questions, but I'm not sure if somebody's watching on LinkedIn, say something and I'll see if I see it. But I know that it has to pass. And of course, we have to say, because today is November 3rd, please vote on Tuesday. If you can early vote, early vote. If you can mail in your ballot, mail it in. Whatever is the situation. As a matter of fact, I just mailed my ballot yesterday. But please vote, because it is very important. Like she said, for things like this with the insulin, there's other healthcare things that her and I are very passionate about that are going to be decided upon depending upon who is in office. And we really need to make sure that people can afford their medication. I mean, come on. Unfortunately, a lot of people have diabetes. It's unfortunate. But and especially with type 1, where you really have no, control over what happens to your body, please, insulin needs to be a reasonably priced drug for obvious reasons. So can you explain what is considered pre-diabetic?
So to have diabetes, your numbers have to be above a certain range, right? So patients who have pre-diabetes, their blood sugars are high, but are not high enough for them to be considered to have diabetes. I can go over what that is. For example, someone mentioned the hemoglobin A1C. So a normal hemoglobin A1C is anything that's 5.6% or lower. To have diabetes, your number has to be 6.5% or higher. So anything between 5.7 and 6.4, we consider that pre-diabetes. So you're not normal, you're high, but not high enough to be considered diabetes.
Got it. Somebody said my daily readings range in 150 to 180, but my A1C, I think is what they mean, is a 6.
So that's an interesting clinical scenario that I see a lot. So the A1C is a 2 to 3 month average blood sugar. And what the hemoglobin A1C looks at, it looks at the amount of sugar that's on your hemoglobin. And hemoglobin is that substance in our blood cells that carry oxygen. So there's some people who have what we call hemoglobinopathies, where their hemoglobin makeup is not normal. Some of those patients might have a falsely low or falsely high hemoglobin A1C. Chronic kidney disease can also cause false readings when it comes to an A1C. So there's some patients who might have I've had people with kidney disease who their A1Cs come back at like 5.3 and their blood sugars in the office are in the 200s. So I know the A1C is off. So there are other tests that we can do to confirm the A1C. Also, when do you check your blood sugars? You could have blood sugars in the morning down to the 60s or even 50s, but your blood sugars after meals could be higher than 300. Your average might be 120, 140, 150. So you might have a good A1C, but you're having ranges all over the place. So are you checking your blood sugars multiple times a day? Are they always 150 to 180? If that's the case, then the A1C might not be accurately 6.
Got it. So, so that's another thing I love people to know. The A1C is going to tell on you. So please, when you go to your doctor, just tell the truth. There's no need for you to say that I've been, eating, my correct amount of carbs every day and blah, blah, blah. When you know you haven't, and then your A1C comes back and it's, at 8 or something, you cannot
Not
lie.
only that, you'd be surprised how many patients come to see me without their blood sugars.
And
it's like going to see an accountant without any of your numbers. Like what am I going to do? So yes, the A1C is going to give me an overall picture, but I still need to see, your doctors still need to see what's happening. Are you having low blood sugars every night? Your A1C might be perfect at 7, but you're having dangerously low blood sugars during the night. So you should still always bring your meter or bring your log in with you at your doctor's visits, especially if you see an endocrinologist.
Yes. And like we said, ask your doctor about getting a
continuous glucose monitor.
Because it would make your life easier as well as the doctor's. So can we please talk about some of the awful effects of uncontrolled blood sugars?
So I've seen complications of diabetes ranging from the top of the head to the bottom of the feet, So diabetes damages the blood vessels and the nerves that supply your entire body. So you can start from top and come down. It increases your risk for having strokes. Even if you don't have a massive stroke, you can still have small little mini strokes. It can lead to microvascular disease in the brain as well. People who have that might have like memory issues or some cognitive issues. It can lead to heart disease. In fact, heart disease is the leading cause of death for patients who have type 2, who have diabetes. So that means having heart attacks, heart failure. It can affect the kidneys. A lot of our patients end up on dialysis because they have end-stage renal disease. Damage to the blood vessels that supply your feet. If you get like a cut or anything on your foot, because you can't take oxygen for healing, a lot of these cuts end up becoming infected. It can spread to the bones. Even now, I have patients who have recently lost toes. I had a patient who came in, and one of my favorite patients actually, and she's like, Dr. Wood, you wouldn't believe what happened. I'm like, what? And she looked down, and I looked down, and her foot was missing. And I was like, what the heck? She had like a cut on her foot and didn't go to see the doctor for a couple of days. And by the time she got there, it had already kind of infected her bone. So up to today, I still see like these complications from diabetes. It can lead to neuropathy. People complain of like numbness and tingling in their feet. keeping them up at night. The poor circulation and the numbness, lack of feeling. People like step on stuff and not feel it, have things in their shoes and not feel it, have injuries and not feel it. So then their feet become deformed. So I can go on and on. It affects the eyes. I forgot about the eyes, but uncontrolled diabetes and uncontrolled blood pressure, they usually go hand in hand, can also lead to leaking of the blood vessels behind the eyes. Like diabetes, one of the leading causes of blindness in America. So you can start from your head and go down.
Yeah.
And one way to reduce your risk of having these complications is by trying to get the best blood sugar control that you possibly can.
Yeah, that is just awful. We always say, please go to the doctor as soon as you feel or see something wrong, because the earlier, the better. God knows they might have been able to save her foot, but she went too late. So you need to go. And I'm sure, I guess I know people who've lost toes and limbs to diabetes. One of my favorite people from church was one of those people. And, it's just awful. And even, like I said, in my family, we have diabetes and, eyesight. I'm telling you, don't miss things until they're gone. Please don't wait until they're gone. Please don't wait till they're gone. This is not something that you don't, and we're going to talk about it, but there is no reason that you have to live in misery because you have diabetes. So what foods can we eat? Because of course we know this month is Thanksgiving here in the US. What foods can we eat? Christmas is in December. I know that people want to have their candied yams and mac and cheese and some of these other things that have lots of carbs and sugar. What can they have?
So one method that I like to go with is called the plate method. So you can have a plate. Half of your plate needs to be non-starchy vegetables or salad. A quarter of your plate needs to be lean meat, and the other quarter can be a starch. So your body needs glucose for energy. Like think about when you're extremely hungry, you can't function. Like for me, I know I get miserable.
You get hangry?
I definitely get hangry because our brain needs glucose. So if you have diabetes, you're not expected to cut carbs completely out of your diet. You are allowed to have carbs. You need carbs for energy. But it's important to choose the right carbs. So get rid of the white stuff. If you have to have like potatoes rather than white potatoes, use sweet potatoes, has more fiber, wouldn't spike your blood sugars as high or as quickly as white potatoes would. Switch to brown rice, whole wheat pasta, quinoa is another good starch to have. Or just, try to make those small little switches can really improve your blood sugar control.
What about the chickpea pasta?
Chickpea pasta is good too. I think that has a higher amount of protein.
Oh, wonderful.
Than the normal, white flour pasta. With Thanksgiving and Christmas coming up, I'm realistic. I realize that we're all humans. We're going to want to eat with our families. Just don't overdo it. But if you want to have a little bit of something here and there for that on Christmas Day or Thanksgiving Day, go ahead. But try your best to get back to your usual routine the next day.
And I think my thing is, if you're the one having dinner at your house, then you prepare food you want to prepare. So go get the chickpea pasta. I promise they won't know the difference. Make your mac and cheese with that. Sweet potatoes. There is a sweet potato recipe that was lower in sugar because it didn't have brown sugar, and now I can't remember what it was, but it wasn't. It tasted fine. I had them. It tasted fine. Of course, you can have your protein, your turkey, ham, whatever you guys eat, protein-wise. Dessert-wise, you don't need a full slice. Just get you a little sliver. If you must have some pie, get you a small sliver of pie. Or I know Weight watchers has this pumpkin pie. I say in air quotes because it's not really pie, but it's like this mixture, and if you make it really quickly and it has the fake whipped cream, it tastes great. It is, and there's no crust involved, but it tastes great and it's a good substitute. But my whole thing is, don't you want to live to see the next holiday? So And then also, you don't want to ruin anyone's holiday by having to go to the hospital because you're in glycemic shock, or you go hypoglycemic, whatever, anything related to your sugar. You don't want to send in heart attack or stroke. You do not want to go to the hospital. You don't want the whole family to have to stop eating because they have to go to the ER. So please do what you can to have a great holiday. The other thing is, I know many people, they do some form of exercise after their holiday meal. So maybe you guys go to the Thanksgiving parade, and that good walk is a good stretch of walk, and
Mhm.
then you have your meal, and then after your meal you play a game outside. The weather might be warm this year. I don't know, it's very warm in Michigan right now, but just do some sort of activity that's moving your body. But so what do you recommend for exercise so that we don't get type 2 diabetes?
So the recommended amount of exercise for all adults,
Right.
not just those with diabetes, is a minimum of 150 minutes per week. And that's half an hour, 5 days a week at a minimum. If you can do more, even better. Try to find an activity that you like. If you don't like running, like don't be out there trying to run for 30
Right.
minutes.
Exactly.
Like do whatever you like. If it's walking, hiking, riding a bike, dancing, doing Zumba. I also recommend not only doing cardio, but also a couple times a week, incorporating some strength training as well. That has shown to be better than just cardio alone. But whatever you like to do, just do it. And if you say, you know what, I can't get up, I can't do 30 minutes, just start off at 10 minutes a day. Or if you want to break up the 30 minutes to 15 in the morning, 15 in the evening, whatever it takes. And, don't get discouraged if you can only do 2 times a week. Whatever you can do for exercise would be beneficial to prevent diabetes. And if you already have it, would help you control it even better.
So you said type 1 there is no cure. Type 2 though, there is a way to get yourself into remission, quote unquote, right?
Correct. So remission is when your blood sugars are not in the diabetes range, off of medication for at least 3 to 6 months, for 3 months.
So you guys, it is possible, but you have to be a stickler for. I have an uncle who did it, and he drank a whole lot of water, and he walked a lot. And I don't know what his diet was like, but all I know is that he kept taking his medicine because he was a good patient. God bless him. May he rest in peace. But he kept taking his medicine, and they ended up having his blood sugar was too low because he was taking insulin and he shouldn't be taking anymore. So that's when they figured that out, and he was taken off of his medications.
Yeah, I have been able to take patients off of medication. A lot of patients get really depressed because they think, once you start insulin, we'll never get off of it, or once you start medication. That's not the case. It's easier to go into diabetes remission the closer you are to your time of diagnosis, meaning within the first 3, at most 5 years of being diagnosed. That's the time when you should be working really hard to get off of medication. Someone who's had diabetes for 20 years, 25 years, less likely to be able to achieve remission, but still try, especially those of you who were recently diagnosed, is entirely possible.
That's awesome. So nowadays, in those same commercials, we see these commercials about these drugs that for diabetes, and they always say, and they cause weight loss. So there have been a lot of people, and I know that have been prescribing these as weight loss drugs, but I
And
mean,
that's why we have a national shortage now.
oh, I didn't know.
Hmm. Hmm.
Wow.
So yeah, these are newer types of medications. They're usually injections that you give once a week. Many years ago, similar medications were giving them twice a day or once a day, but now the longer acting ones you can give them once a week. And the medication class, they're called GLP-1 agonists. Not going to go into what that is, but basically examples would be like Ozempic,
Wegovy.
Trulicity. Wegovy is actually the same drug as Ozempic, but
Okay.
Wegovy is approved for weight loss, and it goes up to a little bit higher of a dose. Ozempic is only approved for patients who have
Diabetes.
diabetes.
Okay.
So how these medicines work, they slow the emptying of your stomach, so they slow digestion down. So your blood sugars don't spike as high, and you also feel full quicker. They cross over into your brain, so they make you feel full. You're not as hungry. So people tend to lose weight. I've had patients lose 28, over 20 pounds on these medications. So because they work so well, first thing was Wegovy. You couldn't get it. So I'm not sure if people were prescribing Ozempic only for weight loss, but now a lot of my patients who have diabetes can't get Ozempic anymore because there's like a back they're on back order at many of the pharmacies.
Wow.
Yeah,
Wow.
I've not seen them myself because I'm not really on TikTok like that.
Yeah.
But I've heard that there've been TikTok videos of people like taking these medicines for weight loss. Yeah, it's a big thing now.
I've not seen them on TikTok either. Like I said, maybe we'll do another show and talk about our weight loss, but that's not what neither one of us did. But we didn't take any pills. We just ate good food and exercise, because we do believe in exercise, and we are Pelotonners.
Mhm.
But so I hope everyone understands you have to do some form of exercise. So if you can just 10 minutes do a dance break in front of the television 3 times a day, you guys, this is not a lot. This is not a lot. If you like walking, walk. If you like to run, God, I ran this morning. I ran 30 minutes. I don't like running. I just like to hurry up and get the workout over. And so that was a way to hurry up and get it over with. I ran outside. It was 50 degrees, so it wasn't freezing, and I got it over with. But what I have severe food allergies, in case this is your first time watching, I talk about all the time. And what I cannot do is have diabetes and be able to take more foods out of my diet, because I've already got a list that's already shorter than everybody else's. That would just kill me. So therefore, I exercise and I watch what I eat so that then I can continue to eat what I want to eat. Because I have way too many family members that are checking their blood sugars, and I was like, that's not going to be my story. So, yeah. But and I don't have an endocrinologist because I don't need one, because right. So I'm telling you guys, let's work smarter, not harder. If you have type 2 diabetes, let's work on controlling our blood sugars and making our doctors happy by reporting them and listening to them. Dr. Kelly has this one story about her one patient. How is she doing? She's still doing good?
She's doing good.
So she had a patient who was like, Dr. Kelly was like, this is a Southern woman. And she was like, I don't want to not be able to eat this, this, and this, and this. So Dr. Kelly said,
so we had a little negotiation. I said, you can have your cornbread once a week.
but she came back and
the numbers had definitely come down. So like I said, like I'm realistic. You're gonna eat something that you're not supposed to eat at least once in a while. I do too, but just don't make it a habit.
Exactly. And so I thought that was lovely. And this lady was an older woman. So
in her 80s.
How old?
In her 80s.
See, in her 80s. But she took charge, and so you didn't have to put her on medication, did you?
Not on insulin. Definitely.
See? No insulin. Because she listened to the doctor and said, okay, this is what I'll do. I'll do this. So you guys, we just have to, like I said, work smarter, not harder. Let's, if you really have to have a cookie and not every day. And drink your water. Water's your best friend, I'm telling you. Drink your water. Water has lots of benefits. But Dr. Kelly, how can everyone find you so that they can follow you and see all the great things that you post?
So you can find me on all social media handles at Dr. Kelly Wood, MD. You can also go to my website, drkellywoodmd.com.
Perfect. I put her website in the post, so you can click on that And then you can follow her on IG. Of course, I put her IG information in there as well. But thank you so much for joining us. And everyone, please, let's be good to our doctors and get our blood sugars to them and all that great stuff. And I will see you next time. Bye.